My name's Douglas Brands. I'm a consultant clinical oncologist. I treat patients with gastrointestinal cancers, and that includes things such as esophageal cancer and liver cancer, but can cover anywhere from the top of the GI tract down to the bottom. One such exciting innovation I've been able to be involved with is proton beam therapy, which I think offers some unique opportunities for the treatment of gastrointestinal cancers. We would look at a patient's pathway depending on the tumour type they have and work out how it fits in for them. For the example of esophageal cancer, patients will principally benefit from having it in place of the usual radiation therapy called photon radiation therapy. This can be given before surgery for patients with esophageal cancers in certain cases where it's used to shrink the cancer down and help with surgical outcomes. In other cases it can be used as a definitive treatment, so used on its own to try and cure the cancer. In the other case that we would commonly treat, which is liver cancers, this is something where patients who have cancer of the liver, where other modalities to treat smaller areas are not appropriate, proton beam therapy may be useful, particularly in the treatment of larger tumour areas where it's possible to spare more of the liver using the proton beam approach. Proton beam therapy may be the best choice of modality for treatment in patients with esophageal cancer where we are concerned about dose to the heart or lungs. Standard photon radiotherapy spreads the dose out throughout the chest, affecting the heart and lungs to a fairly high degree. For patients that are going on to surgery, there's evidence that proton beam therapy can spare the lungs and reduce the chance of having post-operative infections. And for patients who are having definitive or preoperative proton beam therapy, reduced dose to the heart is likely to correlate with a lower chance of subsequent things such as heart attacks or other coronary events. From a quality of life perspective, proton beam therapy offers potential advantages over photon beam radiotherapy. This could take the form of having fewer days in a hospital with severe lung infections, and for patients trying to get over a very serious operation, that can be a very meaningful difference because this is a very difficult time during the overall treatment pathway. At Proton International London, patients will have their care delivered by a dedicated consultant, and from the initial meeting through to on-treatment reviews and then follow-up afterwards, it's really important that there is a relationship between an oncologist and a patient so that at each step of the journey, both parties are fully up to date on what's going on, how a patient is feeling, and what the next steps need to be to tailor that treatment pathway to an individual. If you feel that proton beam therapy might be something you'd be interested in, you can have a discussion with them about whether it might fit into your treatment pathway. Particular areas where it might be considered would be where you are being recommended to have photon radiotherapy, and a reasonable question might be, would there be an advantage to proton radiotherapy? Many oncologists will potentially not have used proton radiotherapy themselves, and at Proton International London we would always welcome inquiries from patients or from treating oncologists about whether there could be a role for proton beam treatment within a patient's pathway.